When a child is said to have special needs, it generally means that they will require much more assistance in education and developmental services than that needed by the average child. So, for example, a child with ADHD or autism or specific learning disabilities, they will not be able to properly adapt to the regular mainstream classroom, or at least not on its own. They will require additional assistance and support from trained professionals to get them to meet their optimal level in functioning. So symptoms vary across disabilities and even within disabilities. So, for example, if your child is said to have poor social skills, it could mean that they have difficulty with showing good eye contact or difficulty in demonstrating pretend play or good interactive play with other kids. Or if your child is said to have speech or language difficulties, it could range from your child not being able to have any verbal skills at all to children that do have some good receptive and expressive communication, but just perhaps some difficulty with articulation or reading. So what's important as far as looking for symptom signs is to take a good look at the child's early history and when they met their developmental milestones, particularly as an infant or in their early toddler phase. Another important part is to listen in on your child's teachers' comments about your child, because they will actually have a lot of direct observation with how your child is functioning in the classroom in a social and educational settings that you may not notice at home. So unfortunately, many parents are disappointed when, even after so much testing, doctors can't find a specific cause or reason why your child has these special needs. Because oftentimes it's not one particular reason or cause. It's a combination of genetic and biological factors as well as environmental factors. And as for me in my field within social sciences, it's very easy to see how environmental factors play a big role in your child's disability. So, for example, family stressors or the lack of educational opportunities or parent communicational styles can really either minimize or emphasize certain disabilities in children. Depending on, obviously, the strengths and weakness in your child's, services and interventions can include very intensive one-to-one programs or less demanding support services that can be simply applied to the child's current curriculum classroom. It is very likely that the intervention will be a long and gradual process. We have to understand that these children cannot overcome their difficulty overnight, so therefore they are going to require support over a longer period of time. Once you have a hunch that your child may be having more difficulties than the average child, you want to seek professional help or in consultation immediately to avoid further difficulties or prevent severity of some cases. So, here in the UAE, the accessibility of qualified services to meet the special needs of these children is at a relatively early stage of development. So oftentimes it appears that resources are limited. Nevertheless, with some good research on the parents' part and referral contacts, you can find excellent clinicians and support staff to help your child. Interestingly enough, while we don't unfortunately have national statistics on the rates, the prevalence of special needs or the ratio of the treatment of the children treated with special needs, I am actually very pleased with the increasing amount of families that are seeking support and education for their children, despite the stigma that still exists in our community.
For more details, visit www.dhcc.ae or call 800-HEALTH. Dubai Healthcare City, setting new standards in patient care.